Dr. Jain Panda for introducing me in a so kind words. And before my formal welcome comes, it is my address which has been there. So I welcome you all in this conference. In this odd times, you could be able to make to travel, taking so much of the difficulties, and you came here. And apart from that, when we decided that this will be the theme of conference, then many people were really astonished and amazed, and this theme has not been seen for a long time. It's primary health care. What are you going to do about the primary health care? What are you going to talk about the primary health care? Probably are you going to talk about the villages, and probably you are going to talk about the primary health care centers and like that. But the COVID has really made us realize that how primary health care is important. It was the time when I was doing graduation and post-graduation. At that time, many doctors were not really willing to do for the post-graduation. They usually choosing to go into the villages to work there, to join the PHC. Even after doing the MD, most of the doctors prefers to go into the state medical services instead of doing the practice, or instead of making the nursing home, or instead of coming to the medical colleges. But after 20 years of that, the trend has been completely changed. Now everybody wants to be in the tertiary hospital. Everybody wants to be in the corporate hospital. Nobody wants to work at the primary healthcare center. And this is the mother of all evils. And because of what we are facing, so many diseases, so many problems, if we can really strengthen our primary health care, then probably we may not be requiring so much of the tertiary hospital. Probably then we may not be requiring so many of the dialysis machine. We may not be requiring so many of the cath labs and many other kind of the things what we talk about. And as far as the technology is concerned, now we are seeing that many conferences are having their theme in the technology. My previous lecture, Dr. Soumitra Ghosh, has proven that technology can be used anywhere. And as much as it is needed in the primary healthcare, nowhere it has been needed before. So it is really a thing which can make the difference in primary healthcare if we use it rightly. So I shall be talking in next few minutes about the primary healthcare in India, what are the challenges and what could be the solution. Although for the solutions we shall be discussing here for next 2 days, but let me tell you about the challenges. The biggest challenge is the population. We are here to care billion and more. So a billion people's caring is not at all a difficult. We are the second most populous country in the world. We are having death rate less, but birth rate high. After the independence, we have improved our health system. We have made so much of the improvement in our healthcare that death rate has declined. But we could not make it that birth rate may not increase. It is overburdened healthcare system. And the biggest surprise is that despite producing 67,000 doctors every year, our doctor population ratio is at just half mark what is suggested by WHO. So where these 67,000 doctors which we are producing every year going? They are not in our country. They are not serving our population. Otherwise, this ratio must not have been in this shape. Healthcare system, it starts getting crashed when a pandemic comes. We talk about a lot of things. We say that we are having this, that, but whenever a pandemic comes, then everything is crashed. Why? Because in the time when pandemic is not there, when crisis is not there, we are really not looking forward towards the health facilities. Because of being ignorance, we are not using our health facilities. We are not taking enough care towards the health facility that causes whenever there is a crisis, then everybody comes into the panic and hospitals gets overburdened. And poor awareness is one of the very important reasons for that. People don't use health facilities when there is no pandemic. They remain in their dilemma whether to go hospital or not to go hospital. Most of the time they start using the alternative therapies. Many of times they start using the divine therapies, but they don't go to the hospital. But once the pandemic kind of the things come, they start going to the hospital, then facilities are not there as per their requirement. Doctors are not there as per their requirement. if we keep on continue using the healthcare facilities in the good times also, then definitely they will also be good in our bad times. Of course, they will be little overburdened, but the situation will not be like that as it happened in the COVID time. There has been a review which has shown that morbidity found in the geriatric population, that 20.3% of the participants who were aware of the common causes of the prevent illness and their prevention. Adequate knowledge regarding the breastfeeding practice was found in only 1/3 of the antenatal mothers in 2 studies. These are the just examples of poor awareness. This poor awareness is driven by the low educational status, poor functional literacy. What I call the functional literacy. People are literate, people are well educated, but still they behave like illiterate. Many of the people, those who are well educated, but they don't go for the proper medication, they still try to treat their diabetes with the Karela and Methi. So this is the functional illiteracy. So functional illiteracy is a biggest danger, because people are literate. You can make the person understand who is ignorant. You can make the understand who doesn't know. But you cannot make a person understand who knows everything. Still, he becomes, he tries to become ignorant. Low priority for the healthcare in our population. Poor educational status leads to the non-utilization of the scanty health services and increase in avoidable risk factors. So, but we have seen in the past, awareness drives works well. I still remember 20 years or 25 years before, when I was studying in our medical school. At that time, the first resolution has been passed by our parliament that smoking will not be allowed at the public places. And we laughed at it. We said every corner of the city, every crossroad of the city is full of the people of the smokers. There are the small bites of the smokers, and people are having a gathering. Nobody can ever believe that someday after 10 or 20 years, India will not be seeing any smoker on the road. Now, this is a time that we don't have any smoker in the train. We don't have any smoker on the road. We rarely see any smoker in the public places. And even if the person smokes, then people raise objection. Now people have started doing the smoking in the smoking lounge. So it is wrong that drives does not work. Awareness drives always work, but it takes its own time. It takes some time, but for that reason, we should not leave that. We should continue encouraging these kinds of the drive. Encouraging is the efforts to enhance the awareness, shown promising results. As I said, that we keep on continuing. A number of examples are there in which we have seen multiple health problems, environmental health and nutritional awareness, and reproductive and child health following intervention has been improved after the awareness drive. There has been a review on the effectiveness of an intervention on adolescents. Reproductive health showed a considerable increase in the awareness levels of the girls with regards of the knowledge. A study in Bihar and Jharkhand demonstrated improved levels of the awareness and perceptions about abortion following a behavioral change intervention. So we must continue to strive to raise awareness in those whom we work with, and we must encourage the younger generation to believe in the power of education from behavior change. If we talk about these challenges of the twin epidemic, what are the twin epidemic? This twin epidemic, one of the infectious disease, the other of the chronic degenerative diseases. One epidemic is coming to us because of the poor implementation of the public health programs, and another one is coming up to the increasing life expectancy, demographic transition with the rising life expectancy. India faces high burden of the disease because of the lack of environmental, sanitation, safe drinking water, undernutrition, poor living conditions, and limited access to preventive and curative health services. And I am proud to say it here that ACP has taken initiative in this direction. ACP has organized a month of nutrition. In the month of nutrition, you can see that there has been a talk on the safe drinking water. We kept a talk on the diet drinking. We kept a talk on the artificial sweeteners, as well as we kept a talk on the artificial coloring agent, what we use in our day-to-day life. And I am very happy to say that the talk has been taken by Smriti Rastogi, who is here only and running this program. So in we have taken these kinds of the stuff. These are non-popular topics. These are not those topics which raises adrenaline release or which causes some excitement among the listeners. These are the topic people least likely to listen, but they are required for them. We doctors need to know what is there in the diet coke, what we are using and what we are saying to our patient to use. We must know what is there in the artificial sweetener. We must know what is there in the artificial coloring agent. So lack of access is that opportunity to use healthcare system is denied. It is mostly determined by the availability, supply, utilization, knowledge. Availability is there, supply is there, utilization is there, but knowledge is not there, it's all useless. You cannot use anything, whatever is available. We are having a lot of barriers for the access, like maybe financial, people may not be having enough money. India is the only country where people has to pay from their own pocket for reaching to the medical health as well as for the services which are required for their livelihood. Social, cultural, lot of domains are there which limit the utilization of these services even in places where they are well available. If we talk about the health expenditure, most of the government take them as a debt loss instead of investment. We never consider that if we are investing towards the health, this is good and probably this is giving us the return. We always expect the immediate return. Public health expenditure in India, combined total center and the state government, has remained constant at approximately 1.3% of the GDP between 2008 and 2015 and increased marginally to 1.4% in 2016 to 17, and this is less than the world average of the 6%. And you must note that the National Health Policy 2070 proposes to increase this to 2.5% of the GDP by 2025. And still you can see in India, majority of the health expenditure or health finances is coming from the household revenues. 71% is coming from the household revenues, meaning people are giving or paying the cost of good health from their own livelihood, what they are earning. It is not really state sponsored. Only 13% is coming from the state government and 5%, 6% is coming from the union government. States keep their health budget very low. And India is one of those countries where you can see that majority of the healthcare is being taken by the private sector, not the government sector or public sector. On the other hand, you can see the United Kingdom where 75 or 80% healthcare is by the public sector or government sector. Only 15 or 20% is by the private sector. So this is again a very difficult situation where we are living with, and we really need to address it. And this can easily be addressed. It's not necessary that we cannot address it. Poor access to the healthcare system, growth in the, this has been said by Dr. Amartya Sen. We should not only focus over the GDP. We should not focus over the growth in the national income by itself. In fact, national income by itself is not enough if the benefit is not being passed to the next generation for getting better food, for better access to the health and better education. We can see that majority of the people die under the age of the 5. 10% of them have the disease burden, which could be avoided if by simply safe water access is done. And more than 20% disease burden can be avoided simply by eliminating the malnutrition. So this is 30% disease burden can be reduced by doing these two simplest, smallest thing, what every citizen of this world has a right. That's by the age group in developed and developing world, what we can see here. India and in fact developing world, we can see more deaths are occurring from in any age group except the more than 70, because in developing world people are usually does not live after the 70 years of the age. That's why more deaths can be seen after the 70 years of the age only in the developed country. If we talk about this distribution of the disease burden, which could be seen in the 1990 and 2020 projected, it has been simply replaced 56% by contributed by the communicable diseases, which has been replaced by the non-communicable diseases nowadays. The causes of the death are not really changed. They are still there, the same ischemic heart disease, cerebrovascular disease, and lower respiratory tract infection, which were there in 1990, are still ranking in 1, 2, 3 in 2020. Access of the healthcare in India, if we talk about India has roughly 20 healthcare workers per population. Doctors of the modern medicine comprising 31% of the workforce, nurses and midwives. So it is not needless to say that we are having the health force which is much less than the required. So if we talk about the healthcare in India, it is the increasing cost of the curative medical services. High-tech curative services are not free even in the government hospitals. Limited health benefits are there to their employees, and health insurance is very, very expensive. Curative health services are not accessible to rural population. Lack of the primary health care is again there. Poor patient-doctor relationship is there. Rising health expenditure mostly coming from the private sector. So what are the solutions of that? Prevention and early diagnosis and treatment, if feasible, are the most cost-effective strategies for most diseases. Promoting healthy lifestyle from early life is a no-cost intervention which needs to be incorporated in school curricula. There is need for increasing public awareness of the benefits of healthy lifestyle. So healthy lifestyle can be enumerated by doing all these things. Maybe some more can be added: abstinence from the tobacco use, regular physical exercise, balanced nutritious diet, which may be rich in vegetable, fruits, low in fat, refined sugar, avoidance of the pre and extramarital sex, yoga and meditation, avoidance of the alcohol and substance abuse. Healthy living is to be promoted. Interventions with a large potential impact on the health outcome may be brought by the immunization. Dot treatment for the tuberculosis, maternal health and safe motherhood interventions can be applied. Family planning may be promoted, and school health interventions are very much required. Thank you very much for your kind listening for this.